Good morning. I'm Dr. Duke Majan. It is March 25th, 2025. Our patient travels from Illinois. She's been suffering with back pain for many years, and we did an MRI review. Her MRI is from last year. It shows that there are several discs in the area that she's having pain, but what it does not show is a fracture of L4, which we can now see on the x-ray in the operating room. So since her MRI a year ago, she has now developed a fracture of L4 vertebral body, which we're going to have to fix, but not now. We're going to do our surgery that we plan to do, and then we're going to have to fix that probably tomorrow for her. We'll talk to her about it because we were not aware she had a fracture, but sometimes you find things in the operating room like an L4 fracture. All right, if you have questions, feel free to ask us. In the meantime, Henry, let's show the audience the 30 different things that cause back pain, because fractured vertebrae is definitely one of them, and she has an L4 fracture. While we get started. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Okay, welcome back. We've just shown you our video on the 30 causes of chronic back pain. So if you know somebody who has chronic back pain for more than 6 weeks, on and off or constant, then their back pain is most likely coming from the causes that you just saw. And one of those causes is a fracture. And it looks like there may be a fracture of L4. It's hard to tell, but on the x-ray it certainly looks like it. But she has scoliosis, and sometimes you can be fooled by the scoliosis. So we're going to double check in a minute, but I think there's definitely some loss of height. You can see it on the AP as well. All right, we're just about to get our needle in on the left side at L23. Give me a second. I'm about to get in. Let's just see. She's very difficult to get into, by the way, because her spine is so collapsed, meaning the discs are so degenerated. And I get people all the time asking me, well, if my discs are collapsed, don't you have to do a fusion? The answer is no, we don't. Because even though your disc is collapsed or not collapsed, the cause of the back pain from the disc is the same. It's a small tear that's located in the back of your disc. It's called the annular tear, posterior annular tear. And that posterior annular tear is the cause of back pain, the primary cause of back pain in 85% of patients with chronic back pain. All right, I'm trying to get into the 2-3 disc. We're already into the 1-2 disc on the right. Trying to get into 2-3 on the left. Everybody agree we're supposed to do 2-3 left, right? There we go. And I think we got it now. She is difficult because of the depth of her spine, but also the collapse of the disc. It's made it not easy for me, but we're sitting right at the edge of the disc there, right in the back. There's a bunch of bone spur and collapsed bone, almost bone on bone. So it's making the entrance very narrow. So it's making it hard for me to get my needle in. But we should be able to get in later. If I can't get it in right now, we should be able to get it in later. It looks like it's just starting to go in. So that's good. And then we got one more to do from the left side. That's the number. So this is 2-3 on the left. We're doing 1-2 on the right, 2-3 on the left. And then we've got, I think, 4-5, correct, is the next one, on the left side. All right. We're right there. So either way, we'll be able to get in when she's asleep. And again, you can see L4 looks to be somewhat collapsed. I don't know. So I'm going to do 4-5. So let's see, 1-2, 2-3, 3-4, and then there's 4-5, correct? All right, so I need you to help me line up 4-5. It looks like we're off on orbit a little bit. I don't know if I can get in through the same incision. I should be able to. So I'm going to make the incision because I'm going to try to get in on this side, this same incision as I'm at for L23. I'm going to try to get down to L45. So we'll see if I can make that happen. I got to aim downwards towards the L45 disc. I know we have questions, Shot, and I'll take the questions right now.
Alrighty, we got a couple questions. First one coming from Lanu on YouTube.
Hi, London.
Asking an accounting question. The electric bill is high for the building. Do you itemize the electric bill when filing tax?
I don't know. I don't do the taxes. Our accounting firm does that. I honestly don't know. I think it's written off as an expense. But good question.
Next question coming from Ping on Facebook.
Yeah, Sean?
Asking, hi Doc,
Hi.
if you turn your head...
Hold on a second. I think we're off on orbit there, Jordan. Sean? Because it looks like... Yeah, that's better. Right there. That's better. Thank you. Sorry. Go ahead, Sean.
No worries. Saying, if you turn your head...
I think we're lateral.
And
Go ahead. Give me an AP.
And there is no pain. Are my facet joints okay? It's only when I hyper-turn my head to the left or right I feel an ache. When rotating the head in a circular motion, I can hear and feel grinding. Is this a bad sign? And do cervical discs naturally fuse? And when cervical discs naturally fuse, do you lose movement? I was worried mine may have, but I still have full range of motion. Thanks again.
Yeah, so cervical discs almost never fuse on their own. Never. I don't see that happening. It's very unlikely. The problem is her spine is rotated. Sean, I think that's better. But it's too far south. 1, 2, 2, 3, 3, 4, 4, 5. Her spine is twisted. She has scoliosis, making it a bit challenging for me to get into the L4-5. I think we're off on orbit again. I don't know if she's moved or what, but try, Sean. That's better. Yeah, that's better. All right. So you have to, if you're going to do this type of surgery, you must, as a surgeon, navigate using the X-ray machine. And it's very important that you get the alignment where the X-ray is pointing through the patient. You must get that correct. If you don't, then you're going to be off. What is it? You're going to be off by quite a bit. And that will make it inaccurate. You don't want that. You must maintain accuracy if you want to get to where you're supposed to go. Shot? All right, this is challenging because I think the facet is enlarged. I'm trying to get around it, but it's displacing my needle to where I don't want to go. Let's see about this. Let's go AP. We're going to do her discs first, then we're going to go on to her. Yeah, look at that facet joint. My God, that thing's huge. Show the audience how big that facet joint is. It's grown. No, it's even further. See the bone to the left? There, yeah. That thing is massive. So Ping, I don't, you're asking questions. I can't diagnose whether you have facet pain or not based on what you're telling me. I have to see you and make you do the movements for me. But I know you want to figure it out. But if we've already done an MRI review and I diagnosed you with facet pain, then you have facet pain. If we haven't done an MRI review, then I recommend you do one. All right? That way, Shot? That way we can make a diagnosis. But you're not going to be able to diagnose yourself. I have to diagnose you. I have to watch you do it. I know. It seems easy, just cut the middle guy out, but unfortunately, when it comes to making the diagnosis, you need my eyes on you. It's not something that you can just do on your own. But that said, rotational pain is definitely facet pain. All right, so that's looking pretty good. Let's see where we are on the AP view. Again, if I'm getting pushed too far lateral, that's a problem because of that overgrown facet. She's got some staples too. Oh no. I think we may be too far lateral. It's really hard to say because I'm looking at the pedicle below and we're actually lined up pretty good with the pedicle below. You see the pedicle below? Yeah, we're right there. Yep, and look where the needle is. Go to the lateral border of the pedicle and the needle is exactly at the lateral border of the pedicle. So actually that looks good, but you see the vertebral body above, we're not quite at the pedicle there. That's because it slipped forward. So we have a little more distance to cover. But I think we're actually okay here. Is she ready? All right. Let's show the audience. Lay still. Let's ask the audience, why do people get, let's show the audience, why do people get back pain from a herniated disc? Shot?
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
In your back? All right, we're almost done, I promise. I apologize. So it's right there at the base of that disc, which is really a good spot for me to be, but give me a second. We're almost done, I promise, okay? There we go. All right, you helped us and we did it. Are you comfortable? How long have you had back pain for? How long? How many years? 10 years? Still trying to get that other needle to go in. See, it's sitting right at the back of the disc at 2-3. Sometimes I can jiggle it just a little bit and get it in, but we'll get it in for the surgery. I was just kind of hoping to do a discogram there, but if we can't, we can't. All right. Well, 10 years of back pain, folks. And after today, it'll be gone. She's from Illinois, right? Did I spell it right? Illinois.
Yes, that's correct.
I was watching Fox News last night, and they had Johnny, who works with Hannity. Was it no? He works with yeah. Not Hannity. He works with what's his name? Jesse Waters. And he was interviewing high school students at the beach for spring break. And he was asking them, how do you spell Mississippi? And you wouldn't believe it. They couldn't even spell Mississippi.
I saw the one 3 branches ago.
They asked, yeah, that's it. They asked who was the president of the United States, the first president. They didn't know. I mean, our kids these days don't know much. All right. So you showed the video on how a disc injury will cause back pain, correct? Henry?
Correct.
Yeah. So lay still. Don't move. You're in surgery. We just need you to lay still. We're almost done. When I asked her, where is your back pain? She had pain here. She had pain here. And she had pain here. Right? She's saying yes. She's saying uh-huh. This is the piriformis pain. We're going to fix that later today. This is the SI joint pain. And she also had facet pain on both sides. We're going to fix that too next. But we're going to start with her discs. Are you comfy? Don't pick your head up. Just talk. Are you having any pain? All right. How bad was that on a scale of 1 to 10? How high did it go? How high? 10? All right. So L1-2 is a 10 out of 10. Is that where you get your typical pain? All right. She said yes. So, folks, we just tested L1-2, and it caused 10 out of 10 pain. That pain will be gone when the surgery's over, okay? How long have you had that pain? Over 10 years. Over 10 years. I'm apologize. I'm sorry, but we're going to... The next disc down that we're going to test is number 4 or 5, right? Look at that. It sucked the dye into the disc already. I didn't inject it. It sucked it in because of vacuum space phenomena, right? When you have a severely degenerated disc, it has actually a vacuum in there, like space. And if you put a needle in, it sucks the air in, but since we put the needle with the dye, it sucked the dye in. Are you comfy? All right. Any pain? All right, how bad is that on a scale of 1 to 10? 10. Is that where you get your back pain? Good news, that's going to be gone when you wake up. Isn't that wonderful? So we were able to test 2 out of the 3 discs. We're fixing the third one. The needle is right at the back of the disc. There's no point in doing a discogram. I'm going to wait for her to go to sleep. When she's asleep, her muscles relax, I'll be able to get into that disc. But I'm not going to try right now. All right, any questions? We found painful discs. Next, after we're done here, we're going to fix her painful facets. We're going to fix her painful SI joints. And we're going to fix her painful piriformis muscles. We're going to get rid of so much pain. The only thing left will be that little fracture at L4, which is 10% maybe loss of height. We'll see. We may get a bone scan first. Any questions?
Yes, we have a couple of questions.
All right, before I take them, let me know when she's asleep. Can you count out loud from 1 to 100 so I can hear you out loud? All right, go ahead and ask the questions.
Coming from Lanu once more on YouTube, asking, does she have arthritis?
Yes, she has arthritis. Absolutely. She has arthritis in those discs. She has arthritis in the facet joint. She has arthritis in the SI. That's what we're here to fix, is the arthritis pain. Arthritis just means inflammation of a joint. Arth is joint, itis is inflammation. So arthritis is inflammation of a joint. She has arthritis in 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 13 joints that we're fixing today. Any other questions?
Yes. Next question coming from Gary on YouTube.
Just so you all understand, if you've been watching, we are fixing her with what's called minimally invasive spine surgery. Now, this surgery is called the Duke Laser Disc Repair. It's only available at Duke Spine Institute. We pioneered the technology after doing years and years of laminectomies and discectomies, fusions. We pioneered this technology to basically get rid of back pain and leg symptoms that other doctors are still doing old fusions for. We're doing now more advanced surgery that's far less invasive and safer and better for the patient. Hold on. We've never had a complication with this surgery. Yeah. And we've done over 2,500. All right, we are inside the L4-5 disc on the left side. That was one of the ones we're fixing. It turns out, I figured out years ago, that the back pain people have comes from a small tear in the back wall of their disc. That's it, a small tear. And if you clean that tear up with a laser, you get rid of their back pain. And at the same time, you fix their leg pain. Because that same tear causes their leg pain or sciatica. So what these other surgeons are doing, these fusions and laminectomies and discectomies, it's not fixing the actual problem. Therefore, patients still have pain afterwards. And if you ask your surgeon, will your surgery fix my back pain? They'll say no, because it won't, because they don't know how to fix it. But we figured it out at Duke Spine. We're the only place in the world doing this treatment, and it's working. Our success rate is 99.6% getting rid of the pain from the disc, 99.6%. That rounds up to 100%. So our success rate of eliminating, this is important, eliminating back pain from a disc injury with laser surgery that I do is 100%. And When people have this surgery, they don't have pain anymore from that disc that we're fixing. You guys saw that I tested her disc, right? And she had pain from the disc. That's the only thing I injected was the disc. So basically, that means the disc is the cause of her back pain. But I know she has other causes too, her facet joints, and we didn't test those, but we know it based on her physical exam. SI joint, piriformis. We're going to fix all of them. The point is, Duke Spine Institute is offering true cures to back pain. 750 million people worldwide having chronic back pain that need this surgery. 750 million. But they don't know this surgery even exists. You guys know it exists because you're watching me do it, but we don't have a big budget to do marketing. The news and media channels don't care about medical discoveries anymore. They don't care if you made a discovery that's helping people. They're too busy doing other stuff. Like they're basically for hire by big corporations that want to get messages out. So the news media basically doesn't care about discoveries anymore. They just care about highlighting what companies pay them to highlight. So news is no longer real news. When I grew up, if a discovery was made or something important happened in the world, they had it in the news. So you would watch the news as a kid and as an adult to learn the discoveries that are happening in the world, the new things, the things that are happening. But now media doesn't report what happens anymore. They just report what they're paid to report. So you have to buy time in order to get it reported. And I can't afford to buy time on the media. I don't have that kind of money. We're a small company. Big discovery, but small company. We're hoping to change that, but we need financial help to do so. I don't have the resources myself to be able to pay for that kind of media coverage. All right, let's take some questions from our audience.
Next question coming from Gary on YouTube, saying, "Hello, doctor.
Hi, Gary.
What causes the facets to become enlarged?"
So great question, Gary. I'll repeat questions, by the way. When people ask questions, I repeat them so everyone can hear them. Just in case you didn't hear it, Henry also talks about it, but what causes the facets to become enlarged? So the answer is injury to the facet joint, and Henry will show you a video on that in a moment. But basically, if you have a trauma to your spine, to your lower back, or your neck, like a whiplash type injury, car accident, or a skiing accident, or sports accident, where you suddenly forcefully move your lower back and the joints, they tear what's called the capsule. All right, the capsule tears. That's a soft tissue capsule around the joint. It's a synovial membrane and capsule that get ripped when the joint moves beyond the limits of the soft tissue. So those capsule holds your joint, your bones together, and keeps them from moving too much. You get about 3 degrees of movement, let's just say 3 to 5 degrees of movement in rotation, flexion, extension. But when you have a trauma injury to your lower back, that force that's transmitted to your spine is so great that your muscles and your facet capsule cannot stop the movement, the forward movement of your torso. And so what happens is your torso moves forward at such a rate and force that it overwhelms the ability of the facet capsule to stop the abnormal or excessive movement of the bones, and they go beyond the limit of the soft tissues of the capsule, and it rips the capsule wide open. And then afterwards, for years and years afterwards, you have this movement, this micro movement of the bones going beyond the limits of what they're supposed to. So your body's response is to enlarge the bones, make them bigger in order to accommodate the extra movement. and that results in enlargement of the facets. Okay, facet joint hypertrophy is the medical term for it. You'll see that in the MRI reports. Facet joint enlargement, facet joint hypertrophy. Different radiologists use different terms, but it's all the same. So, a traumatic injury to your facets years ago is the cause of facet joint hypertrophy, because that traumatic injury causes abnormal movement, which then causes enlargement of the bone in a response of your body to try to stabilize that bone. All right, Henry, show the audience how trauma causes injury to the facet joint capsule.
Of course.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. And you can see from our video animation that trauma is the cause of injury to the soft tissues around the facet joints, which are bones, and that the facets then, over time, they enlarge, and we call that enlargement or hypertrophy. That enlargement then can start pinching nerves, but it also, the inflammation in the facet joint from the trauma over time, as the body tries to heal the facet capsule, the inflammation starts causing pain. So you get enlargement and you get pain. All right, let's take some questions.
Next question coming from Lanu, once more on YouTube, asking, one of my medical associates saw the Spine Scam movie during the screening. She told me it's a great film. Have you seen the film yet?
Yeah, it's my film, yes. Yes, Lanu, I produced it. I'm the executive producer of that film. I paid for it, and I also am the editor. I'm the one who edited it. Thank you. I appreciate your comments. I think it's a great film too. Next stop is going to be the streamers. We're going to see who's going to buy it, who wants to buy it, and show it. So hopefully, I'm hoping for Netflix, but maybe Netflix is not the right one. I don't know. Hulu is another option. We're going to be talking to Hulu. I don't know. Who streams more movies these days? What do people like? Where do people go? Huh? HBO? Yeah, so that's another one. Huh? Paramount? I didn't know Paramount, but we're going to be talking to HBO, Paramount, Hulu. He knows all of those streamers. My director he's called the producer too, but I'm the executive producer. Executive producer is the one whose idea and money basically funds the film. Thank you. I hope you liked it. We had a few comments about it. I guess some people thought maybe there's too much cussing, dirty language, but the truth is those people do talk like that. We want to keep it as realistic as possible. So maybe the cussing is offensive, but that's how those people talk. And I don't want to take away from that. I don't know. I have mixed feelings about that because our director wants to maybe edit out some of the cussing, but I said, no, that's them. We want to make this realistic. I don't want to make this something that make people comfortable. I want people to see what it's really like. This is supposed to be realistic, not fake. So anyway, we'll see. But we're doing the final edits right now. He's got another screening he's scheduling with a different group of people in Los Angeles, I think, or California. And then we'll see. So we'll be ready to sell it. So anyway, thank you for your comment. Henry, what did you think?
First, I enjoyed it. It was very nice. I really, when it got to the point where the conference scene came up, that's when I really started to see like the specificity of how of the industry is with promoting fusions and all that. Just like seeing the corrupt side of that, and so that was I thought the dialogue in that and just the writing was very, very well done, and so the production design was incredible, and so yeah, it was. I enjoyed it.
Good.
No.
But was it entertaining? Did it keep you captivated?
What I said to the director, I would say the beginning, when it came to just the pacing, was a little bit slow on my end. But when it came to that conference room, like that's when you get hooked, and then from there till the end, that's where everything got really, really interesting, and captivating. So yeah.
Where did you find it most captivating?
From the conference room to the very end, like till that from that point to the very end. That's where everything you got really hooked and like it got into the characters, the storyline, and everything.
Like the movies, let's say, I don't know, was it 2 hours long?
Hour 47. So yeah, give or take 2 hours.
So at what point did you find it captivating? An hour in? 45 minutes in?
Probably had to have been about a half hour to 45 minutes in. Yeah.
So you think the beginning was slow?
Yeah, the beginning, and then up to where the conference.
But the beginning is the operating room scene and the surgeons talking to each other about money, and I mean it's character development, right?
Sure, and yes, but at the same time, when it just came to their backgrounds and their storyline, I wanted it to make.
Was it boring because you already know that stuff? But what about if you don't? So you work in the medical field. You work around surgery. For you, you see it every day, so maybe that's why it was boring, because it was familiar. But what do you think about for somebody who doesn't see it every day?
As a person watching a movie, I was trying to see where it was going. And when it went to the restaurant scene and the next scene, I'm like, okay, I was trying to understand the pacing of it.
All right.
More, and then once the all the details led up to the conference, then I was like, okay. And then I I was locked in and watching the movie from beginning to end.
All right. That I appreciate your comments. How about you?
I liked it. I mean, I missed the first couple of minutes, at work, but I liked it definitely.
I mean, was it the kind of program you would normally watch, like on HBO?
Yeah, I like stuff like that. So
Is that a yes?
yes, it was good. It definitely started out slow.
If you had one criticism, what would it be? Sean?
The beginning, it ended very abruptly.
It ended abruptly.
Yeah, like she got the surgery and that was it.
Yeah, but that's because it's supposed to be another one, and they're supposed to be the first of like 6 movies. So, you know, it's supposed to carry on to the next, the next and the next and the next, so to speak. It's episodes. We want this to be a series. So we want to leave the viewer like, waiting for the next one, right? Like in The Walking Dead. All right, so move it. So that's okay then. I could live with that criticism. All right. Anybody else here watch it? Nope. My God, you guys. Shot, I give you an opportunity to be the first to see the movie.
I laid out all the
She's
Zoom
wiggling
info.
a little too much. Huh?
No, I was just saying I laid down all the Zoom info.
that's fine.
For that, yeah.
That's fine. All right, so let's hear from our audience then. Who else watched it? What comments do you have? Remember, we want to make this entertaining but also informative, so you learn something about the industry, how corrupt it is, and what drives it. Drives it is money. It's not patience. It's not patient care or good outcomes. It's money. Greed. The wrong people are steering the ship, basically.
At this moment, no comment on the movie, but we do have a question coming from Jack on YouTube
All right, we'll take Jack's question. Welcome, Jack, to our live stream.
saying, "Hi, Dr. Duke. Does the abnormal thickening of the ligamentum flavum cause stenosis?"
Does an abnormal thickening of the ligamentum flavum cause stenosis?
Correct.
So, Jack, it contributes to stenosis, but it's not the proximal cause. But yes, it can contribute. Remember, I'm a neurosurgeon. I've been doing this 28 years, 29 years now. I've seen more spine problems than 99% of neurosurgeons out there, because that's all I deal with, and I've been doing it a long time. And people come from all over the world. So I would consider myself to be a top expert in the subject. And I can tell you right now, you see the surgery we're doing? We're treating stenosis as well as back pain. But the thing you have to understand is the stenosis that's symptomatic, okay, and this is important. I'm going to make a point to you. The stenosis that's symptomatic in the spine is not coming from, ligamentum flavum thickening, okay? It's not. It's coming from the herniated disc and the bulging disc and the osteophyte. That's what makes the symptoms. We're okay. We're okay. I'm just getting into that super collapsed disc. You can see the spreading going on. You guys see that? Because
Yes,
the
we do.
dilator is a wedge shape. You guys see how the bones are starting to spread apart?
Yes,
So remember, we told you that we couldn't get in with the needle, but now we're definitely getting in. We're getting in because she's kind of asleep, and now it's much easier. When the patient's asleep, you can get into the collapsed disc easier. Very important concept. Because their muscles are not tightening down. If you're awake, you're going to tighten your muscles down, and they're going to crush down on the disc. They're going to squeeze down, and I won't be able to get in. But when the patient's asleep, their muscle tone decreases. Your muscle tone decreases when you're asleep. And because of that, I can get into this disc. Any other questions?
At this moment, no current questions.
Yeah, so remover, thank you. All right, Henry, we've shown the audience the 30 different causes of back pain, and we can fix at Duke Spine, we can fix 99% of chronic back pain, 99%. Get rid of it permanently with our treatment. It turns out there's 4 things that are responsible for 99% of back pain. Disc injuries, facet injuries, sacroiliac joint injuries, and piriformis muscle injuries. Those 4 things account for 99% of back pain. Okay? Now, the other things are fractures of bones, which we can also fix, and tumors and infections. Tumors, infections, fractures, and then these 4 structural things that we fix easily here at Duke Spine. It turns out we're the only place in the world that does these treatments. And they're all patented by me, the inventor of how to fix them. Not the diagnosis is not patented, but the treatment is. Okay? Just got my 4th patent here in America last week. And I'm waiting for the issuance. But it's a big deal. Oh, wow. Look at this herniation. Little piece that came out. It's not massive, but It's a good sized chunk. You guys see that right there?
Yes, we do.
I want to show you something here. This is very important. Henry's going to show you the video again about how there's inflammation in the back of the disc and the tear caused by the herniation. And that inflammation turns everything reddish pink. Okay, you guys see that right there? That is inflammation. That pink stuff. That's inflammatory tissue. That's where all the pain comes from. Okay, so this is a piece of herniation that's got inflammation capping it, right where it was stuck in the annular tear. I discovered this as the cause of back pain 18 years ago now. And as a result of that, we've been diagnosing and curing back pain with this endoscopic procedure called the Duke laser disc repair. Folks, stay away from fusions and laminectomies and discectomies. They don't do what we do. They don't fix the problem. They just make it worse. That's why people have to go back and get more surgery and have pain management afterwards. If you ask your spine doctor, are you going to cure my back pain with your treatment? The answer will always be no. Okay, they'll give you some other slippery answer like, oh, we can probably help you, or yeah, maybe 50% chance of 50% improvement, but they're never going to tell you, yes, we will cure your pain. Why? Because they don't know how. They don't have our technology. They don't have our diagnostic ability. Any questions?
Yes.
So why am I bothering to tell you guys this? Some people can read that and say, Dr. Duke's arrogant. I'm not arrogant. I'm trying to save you the trouble and the financial waste of going to other doctors to cure your back pain. That's what I'm trying to do. By saying we're the only place that does this, it's the truth, but I'm trying to help you to avoid having treatments that don't work. There's lots and lots of doctors out there that will do treatments that don't work for back pain. That's what all these doctors do. They do treatments that don't work. We don't do treatments that don't work. Our treatments do work. We're the only place that guarantees our results. We actually offer a guarantee to patients. Okay? It doesn't come with every surgery because we usually discount the price of surgery for people to make it more affordable. However, for people who don't take the discount and pay the full charge, you get a guarantee. And nobody else in the world offers a guarantee for back surgery that it's going to work. Nobody. We're the only ones. That's how confident we are in our results. All right. Any questions?
Yes, we have a question coming from Lanu, once more on YouTube.
Look at that piece of herniation. Oh, it's too big to even pull out of the tube. It tore, but go ahead. I'll take Lanu's question.
Not worry. It was a question for Henry, they said, asking, were you involved with the movie since you have some background in video editing and technology? No involvement in the movie, but
you were involved in the movie.
Yes, I was involved with talking with the director and making sure that everybody can have access to seeing the live screening and everything. Yes, I have involvement in that. When it came to the actual post-production process of that, no. But at the same time, I've had.
But you were involved in post-production. You are. You set up a preview.
Yes.
That's post-production.
Okay.
Look at this, guys. Look at the size of this herniation. Look at that. It's not the biggest I've ever seen, but look at the size of that thing. That thing is big. All right?
Oh, wow. We see it. Yes.
You guys see that?
Yes, we do.
Lower your hand. There we go.
Perfect.
So I just grabbed that and pulled it out. It's super hard. Okay, and it's pink colored. That means it's been undergoing inflammation. Remember, this is the left L23, correct? Yeah. So we already finished the left L4-5. We're now doing left L2-3. And I'm almost done with 2-3. When I'm done here, we're going to move on to facets. Huh? Yeah, when I'm done with the discs. We're going to do one more disc, and then I'm going to move on to the facets. And that'll be a separate stream. Keep the questions coming. Happy to answer them. But Henry was involved.
Yes.
In ways he doesn't even understand yet. But remember, I'm the one who made the movie, so
Of course.
I used a lot of Henry's video content to describe to the team, what's happening and what we're doing and stuff like that. So
This is very true. Yeah. And with that process, yes, I was involved in that sense, and so I'm very proud of it. And this was a really awesome experience, and so just can't wait to see where it goes.
all right. Any other questions?
At this moment, no current questions.
All right, since we talked about the inflammation on the disc just now, let's show the audience what the animation showing how discs cause pain through inflammation.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see the inflammation and how we fix it. We use the endoscope to find the tear. We use the endoscope to identify the inflammation, the herniation, the calcifications, and we use the laser to remove them. Very important. You must use the endoscope to be able to use the laser effectively. You cannot do this without endoscope and seeing the laser and directing the laser. Now, this is an FDA-approved surgery. It's outpatient. The patient's going to go home right after the surgery. She'll do about an hour recovery, and then she's going to go home. Any other questions?
Yes. Well, this is a question and or seeking advice coming from Eric on YouTube,
Hi, Eric. Welcome.
saying, I had a L4 to S1 fusion, and 6 years later, everything above hurts so bad. T7 to T8 is actually putting pressure on my spinal cord now. Had a second nerve block on Wednesday, and it helped for 3 days.
Yeah. Well, Eric, here's the thing. We can help you at Duke Spine, but you're not going to find anybody else to fix your problem. I hate to be so direct with you, but I don't waste time lying to people or beating around the bush. The fact is, number one, we don't even do fusions anymore. We used to do, I've done 1,000 of them. I stopped doing them because they're unnecessary. You see the surgery we're doing right now? Much better. There's no metal, there's no fusion, there's no removing bones and ligaments, no scar tissue, no muscle damage. This is the future of spine surgery, instead of fusions, instead of laminectomy, instead of discectomy. Okay, so why? Well, so we don't get adjacent segment disease. When you operate here, we don't get problems above here because we're not fusing anything. We're not changing the biomechanics of the spine in a bad way. We're actually just naturally repairing the disc and helping the body repair the disc in a way the body wants to. So we don't get that adjacent problems, okay? So if you're going to have any more surgery, come to Duke Spine. Let us fix you the right way. You have a thoracic disc herniation pushing on your spinal cord. That's bad. We're probably the only place in the world that can treat that arthroscopically with a tiny little cut, go in and repair the disc. But I need to do an MRI review with you. I must see you on Zoom, and I must see your MRI. So please go to our website, which is, Henry will post the link there for you. Go there, fill out the questionnaire, send us your MRI DICOM images or upload them, and let's do our Zoom call called a telemedicine visit, and I'll diagnose your problem. I'll tell you what we need to do to fix it. Okay?
Eric's commented, I like the bluntness. It's straightforward and honest. Thank you.
Thank you, Eric. What did you say, Dr. Berndes? Yeah, that's fine. This will be our third and final disc. It's the L1-2 from the right side. We did the other two from the left side because she had more stenosis on the left side at the other two discs. She has more stenosis on the right side at this disc. She has a deep spine. It's way down there. I have to get to it through the soft tissue, but here's the thing. With our surgery, we don't cut muscle, we don't cut bone or ligaments like every other surgeon does. We're just spreading them. What does spreading mean? It's like putting a pin, a little safety pin through your shirt. The pin is not going to damage your shirt. Can you go more north so I can see what we're doing? Yeah, that's fine. You put the pin through the fiber of your shirt. What it does, it doesn't cut a hole in your shirt. It spreads the fibers apart. All right? And that's what we're doing. We're using this dilator to spread her tissue fibers apart. They separate at the tip. And it's like a little, whatever you call it, like a little spreader. I don't know. There's no other word for it, huh? And then when we're done, we take this metal out and everything goes back to where it was. The only damage we do to her body is right there where we cut the skin. There's no way to get through the skin without cutting it. So we got to cut the skin. And that is a 7mm cut. But besides that, we're just separating fat tissue, muscle tissue, fascia with our dilator. There's no trauma. Therefore, by the way, these patients don't need pain meds except for some Tylenol or Advil and a muscle relaxer afterwards. What I'm getting at is, like, when you had your fusion done, I'm sure you were on narcotic opioids for weeks, if not months afterwards, because the pain was so bad. And you had to stay in the hospital, I'm sure. But with this surgery we're doing right now, there's no hospital, there's no pain meds, no narcotics. The patient is going to go home in an hour, and she's not going to take any pain meds. It's just a muscle relaxer and a Tylenol. That's it for tonight. She can go back to work tomorrow. That's the amazing part of our surgery, is a fast recovery, no pain meds, minimal to no pain from the surgery, outpatient, not done in a hospital, no bleeding. We lost like what? A nosebleed worth of blood. That's it. It's very safe. And more importantly, it works. Unlike other types of spine surgery that don't work. This surgery actually cures the pain. All right. Great questions so far. I think we have just a little bit further and we're in enough. Keep the questions coming. Did you re-show you re-showed the DLDR and
Yes,
how it works?
correct. No current questions, but we do have a comment coming from Jack on YouTube.
I do want to say one more thing.
Of course.
With spine surgery, like open surgery that all your doctors are recommending. They recommend discectomy, laminectomy, fusion, artificial disc replacement, whatever. They're going into your spine and they're taking materials out of your spine that you need to hold your spine together. They are very dangerous surgeries, but they're also destructive. Now, here's what's important. This patient probably has some osteoporosis, some weakening of her bones. You start taking things out of her spine, her bones are going to crack, the ones that are left, okay? Because she needs that support from those other structures. During a laminectomy, you're taking bone out. She needs the lamina So if she had a laminectomy, she'd get a fracture afterwards. Okay, so spine surgery increases the chance of fractures in patients with osteopenia and osteoporosis, but not the Duke laser disc repair. And the reason is we're not removing any bones or ligaments. We're not weakening the patient's spine. We're going through a hole that's already there. All right, great. Let's take the question. There's a piece of herniation right there.
We see that. No current questions, but coming from a comment from Jack once more on YouTube saying, I watched the movie too, and as a layman, I should say it was a privilege to see the real and unabashed behaviors of some surgeons behind the scenes of anesthesia. Thank you for your courage.
You are welcome. It's my pleasure. Someone's got to do it. Someone's got to tell the world what's really happening. And the reason why we're doing this is because those surgeries those surgeons are recommending that make so much money for the surgeons and the hospital and the companies that make those implants, those surgeries, they are hurting people. That's why we do the movie. If they didn't hurt people, I wouldn't do the movie. You know, it's just a bad choice for the patient. But when people have complications from those surgeries, what happens is they have to live with their life with a complication, nerve damage or scar tissue or, you know, fractures or adjacent segment disease. They have to live with those horrible outcomes of those invasive surgeries, which are oh so common. And I don't feel right not telling people the truth, knowing the truth and not telling people the truth. And by the way, all those doctors out there know the truth. They're not telling you the truth. All right? We've published our results for now 13 years, and I've spoken at the biggest meetings. Those meetings in the movie, the biggest ones in the world are the American Association of Neurological Surgeon meeting every year, called the AANS, the Congress of Neurological Surgery meeting every year, called the CNS, and the Global Spine Conference, which is held around the world, and the Southern Neurosurgical Society meeting. And I've spoken at all of them, and the World Congress of Brain Mapping and Neurological Conditions. I've spoken at all of these meetings. I've been an invited speaker. I've talked about this surgery at all of them. I've shown the doctors all the results. And yet they choose to continue to hurt patients with invasive surgeries that don't work but make them rich. And I'm sick and tired of them doing it and being dishonest to people. And so I have to do something about it. I feel morally obligated to do that.
Thank you.
Right? I feel morally obligated to do it. If somebody was harming my family members, I would want to know the truth. And that's what we're doing with this movie.
We have another comment coming from Lanu once more on YouTube saying,
Yeah.
I and some of my friends saw the thriller on Spine Scam. Our favorite part is the motion picture, beautiful shots. Maybe this movie can be nominated in the motion picture category in Oscar Academy.
I don't. That's quite a. First of all, thank you. I love your optimism. It's beautiful to me. I don't think we'll ever get an Oscar, but who knows? That industry is corrupt too, right? But you know, I won't say never because it's possible. It's not my goal in life to get an Oscar, but it's my goal to raise awareness for people so that they are going into spine surgery with their eyes wide open, that they know the truth, that they know that there's a financial incentive for their surgeon to do these harmful surgeries. They're harmful surgeries. That they're bad surgeries, okay? If the surgeries were good, I wouldn't be bashing them. But they're not good. We have much better treatment now, and you're watching it. The problem is that whole industry is so corrupt and so greedy and so focused on money and profits. And honest to God, if everybody in the world suddenly knew what I knew about how corrupt the industry is they would stop having spine surgery, all right? And that would literally bankrupt the entire medical system overnight. I'm talking about the hospitals too. So the movie is not, my goal is not to bankrupt the surgeons and the hospitals and the spine implant industries. My goal is to bring about change. And the change I want to bring about is change that's going to help people, the patients. You see, this whole industry has built up around this whole corruption of doing implants and doing treatments for patients that don't work but make a lot of money from the insurance companies. And this will save the insurance companies hundreds of billions of dollars, and they don't even understand it, you know. They don't even understand. They're going to save hundreds of billions of dollars a year in America alone, and the rest of the world as well, by converting surgeries from the invasive fusions over to the Duke laser disc repair. The problem is a lot of insurance companies won't pay for this surgery right now. So, you know, there's going to be a period of time, let's say overnight, that everybody stopped getting fusions. Overnight, what's going to happen, unfortunately, is it's going to bankrupt the hospitals, it's going to bankrupt surgeons, it's going to bankrupt everybody except for the insurance companies. They'll be very happy about it. But what we have to do is we have to do what's called a transition. We have to start training other surgeons to do this procedure. We have to make a transition from what's being done now into this procedure that we're doing at Duke Spine for the last 19 years that I pioneered. If we can make that transition successfully happen, then we can get rid of 98% of spinal fusions that are being done, and we can have people get better results with their surgery and have safer surgery that doesn't have complications. But I've got to train 10,000 spine surgeons in America overnight, right? So they don't come to me right now asking for me to train them. But they will when this comes out and patients demand that surgeons stop doing these invasive surgeries. All right, we're done, and I think our lens has shifted on this, Luis. See it? See it? Okay, you see it, right? The blur, all this haziness. Yeah. So I think the lens just shifted, popped. Is this a newly fixed one? All right, we're done. Good news, we're done, and we're going to move on to the facets. Let me just do a quick grab. No. Any other questions? Because we're going to wrap this one up. We're going to move on to the next surgery. We're going to restream. Go ahead and end the stream.
Copy that.